Welcome to the Our Forever Smiles podcast, a podcast created to support mothers of children who were born with clefts and those who love them. I'm your host, Laura Arroyo. Hello and welcome back to the Our Forever Smiles podcast. We are continuing our ACPA annual meeting series. We are so thrilled to have so many professionals that are helping families along the cleft journey. Today, we have Dr. Vitorela. I call her Dr. Vitorela because that is what her name is on Instagram. So we have Dr. Vitorela here today to share a little bit about herself and what she and her team are working on.
Actually, yes, it's true. My background is trained dentist in Albania, and after I moved here in the States, I joined NYU, and I'm a lead dental assistant, working for the Craniofacial and Orthodontic department together with Dr. Shet. Yeah.
So you are a trained doctor, so you always carry that with you, right? Like it's not just something that just goes away. You're forever a doctor.
Absolutely, yeah. Absolutely. But actually, that one helped me to continue and be in the dental field. And also, with the background that I have, it's always helpful with patients that we see every day, especially the newborns born with cleft lip and nose.
So what's your favorite part about working in dental?
Where I am right now, first of all, I love it because seeing the babies, the newborn babies, going through all those steps and seeing the happiness after the first surgery that especially the moms experience, that is truly a blessing for me to be part of their journey.
So why did you choose cleft care specifically? In Albania, were you doing just general dental work or were you working in cleft care?
Um, in Albania, I was practicing dentistry together with my father. He's a dentist too. And my main goal was orthodontics. So once I found the craniofacial orthodontics, I was like, okay, I will have to apply there. And then later on, I found that they were also taking care of babies. And since I have two boys, I was used with babies. I was like, why not being part of this team? And yeah, I love it.
Hi, I am so sorry to interrupt the show, but I just want to tell you about today's sponsor. Today's show sponsor is Sienna Darn Media Integrated Marketing Agency. Sienna Darn Media is more than just a marketing agency. They are your partners in progress. Their mission is simple: to alleviate marketing bandwidth, allowing creative business owners to focus on what they set out to do: create. Sienna Dawn Media empowers creatives to thrive without the burden of managing their own social media and marketing campaigns. Visit siennadawnmedia.com. And so how long have you been at NYU?
It will be 4 years now.
So what have you seen in dental care or in the dental space that has kind of been transformative or new, or things that parents should be looking out for in terms of cleft care or that can help us, improve outcomes?
When I first joined for with NYU, I experienced the NAM procedure that the Cleft team was doing there, and later on, after a year, we started using Plana, and I would say that is a game changer for patients, for moms, and of course for the team, for the dental team as well.
So how is Plana different than the NAM device?
First, the baby with the NAM appliance doesn't have to go to the process of taking an impression. So there is no device in the mouth, and this will lead to better feeding. There will be no soreness in the mouth as well. The baby will breathe better, sleep better, and also gain weight. And the moms will feel relieved because comparing with NAM, we had to see the patients like every week, adjust the device, and it was like a burden of care for them, for the families, especially for the ones that live far away from the cleft centers. The Plana therapy is a better solution, because we will see the patients approximately 4 or 5 times throughout the whole process.
And so I was really excited to see that there are options for parents. And so what like differences or outcomes have you seen from Plana versus NAM? What are some of those differences?
It's good to have options. It's good for parents that they have option to choose NAM or Plana or other therapies. With Plana, there are 3 devices and 3 lip tape size, large, medium, and small. And the devices are Nosoline number 1, number 2, and number 3. Nosoline number 1 will be used for 2 weeks, number 2 and number 3 for 4 weeks. I would say that the Nosoline device itself will elongate the columella, will support the septum, and also have symmetrical nostril. The lip tape itself will also help in approximating the soft tissue, the cleft. And if you count the visits from Nosoline device number 1 to number 3, there are only 3 visits. And if we start with lip taping the very first week the baby is born, which actually this is what we suggest, we'll count only 4 visits. And then the baby is ready for surgery. So I believe having fewer visits, it's always a positive thing for parents. The ones that live closer, either the ones that live far away from the center. And I think this is truly as I said, super positive.
I'm so excited that parents have different options. So today we're at the ACPA annual meeting. So there are studies everywhere, different people talking about different options that are available. So what studies have you all done to kind of compare Plana to NAM? And I'm sure you have before and after pictures. What does that look like for you all right now? What studies do you have?
My advice for you today, I would love you to join, because we have a presentation coming up today that compares the burden of care and nasolabial changes with Plana and NAM. Of course, studies shows that there is a higher percentage in reduction of the office visits together with the oral and skin irritation. So please join, record, because it will be a very interesting presentation.
I love that also. Yeah, I know that some parents, one of the complaints from the NAM is that sometimes their babies get sores in their mouth or there's some soreness. Yeah, that happens a lot with parents. Yeah, that happens a lot with babies.
That's why with Plana therapy, since we see the patients only 4 or 5 times, we follow up with video call or emails. And we always ask to send photos almost every day if they can. And this is a way that we follow up. And if any adjustments need to be made, there is no need for them to come in the office. We just video call and we advise them to do the proper adjustments. And it's very convenient also because they can remove the lip tape and replace it with a new one every 24 hours. And also they can remove the device, clean it just with cold water. They can use also the brushes that they have for the milk bottle, and then reinsert it again. So this will take them 5 minutes.
I really hope to be able to attend the session today. So outside of Plana, do you all continue to see patients post-surgery and do continued dental care for cleft patients?
Yes. So basically, we follow up with the patients since they are born until they get 20 or 21, since they reached so after the first surgery, we see them 3-week post-op. And now we can also suggest the use of the nose align device as a retention if especially the moms, if they would like to have more correction. So we can use the same device starting from size number 1, number 2, and number 3.
So what is something that you wish providers would change about Cleft care in general? Maybe how it's provided, maybe how information is delivered, how it's explained. What do you think, in your personal opinion, we could change about the way we approach Cleft care?
I would go personally, the more simpler, the better, which means that the easier for the babies, the easier for parents, of course, better outcomes, and make the path of the Cleft journey much easier for the babies. That's my motto. Simplicity is the best.
Thank you. I love that. Thank you.
Thank you. I appreciate your podcast and everything that you do. I really love it.
Thank you so much, Dr. Vitorela, for being on the Our Forever Smiles podcast today, talking about Plana, talking about your work with NYU. It is awesome and phenomenal to have you speak with us today. And hopefully people know how to reach out to you on IG. Families are able to get connected to resources and to know what their options are, whether that is Plana, the Latham, NAM. We want to make sure that families have the resources that they need and the support that they need. So thank you again. Hey everyone, it's Laura here. I'm popping in today because I need your help. If Our Forever Smiles has ever helped you, if you've learned something new, felt less alone, or found hope through this podcast, then I'm asking you to help keep it going. Creating this podcast, sharing stories, and building a space where Cleft families feel seen and supported is something that I pour my heart into. But the truth is, I cannot do it alone. If we want to reach more families and provide even more resources, we need your support. So I thought of a creative way to do this. For just $2 a month, you can help ensure this podcast keeps going strong. For $5 a month, you'll unlock exclusive moms in real life content, real unfiltered conversations about motherhood and career and everything in between. And then for $10 a month, you can get everything plus exclusive merch to show your support. If this podcast has helped you and you want to see it grow to help other families that are probably facing the very same challenges that you are facing right now, please consider supporting us today. Every dollar goes toward making a difference for Cleft families just like yours. And right now, we'll be using the funds to elevate the show for production. So we'll be able to add more video and just get new equipment. And as soon as this community is established and we're able to do more, we definitely plan to go beyond the scope of just this community. We want to be able to support scholarships for new craniofacial surgeons. We want to be able to support global surgeries and just really spread our efforts to continue to make an impact in our community. I just want to thank you in advance, and I'm just so grateful that you all are able to support me and support this community here. And it's definitely something that I'm really looking forward to. The link is in the show notes, and I just want to do a shameless plug here. The Moms in Real Life podcast is so cool, so candid, and yeah, it's definitely something that you'll want to check out. Thank you all again.